Welcome to Salulaw channel. I am Femi Salu. I'm an attorney. I do practice in the states of Mississippi and Tennessee, and this is our fourth episode on difference between misdiagnosis and misdiagnosis. Now, I want you to subscribe and share, and if you have any particular topic that you would like to cover, please do not hesitate to share it or give us an idea of what topics you would like to cover. In the meantime, feel free to ask any questions and let us know if you have been affected one way or the other by some of the topics we are covering on this episode 4. The topic will be difference between misdiagnosis and misdiagnosis. Let me repeat that again. Difference between misdiagnosis and misdiagnosis. It sounds similar, but it's different. Close to 5% of patients' medical treatment in the United States are considered either misdiagnosis or missed diagnosis. The percentage may look small, but the impact on patients' health care is huge. But identifying the difference between misdiagnosis and missed diagnosis can guide a patient in deciding whether you have viable medical malpractice against your medical provider or not. On misdiagnosis, I want you to know this. When your doctor tells you you have some illness or condition, but it's incorrect, that is misdiagnosis. That is, your doctor is telling you you have some illness or you have some condition and is wrong. That happens more than you might think. Such a mistake on the part of your doctor can be life-threatening. For example, if cancer is misdiagnosed, this is a nightmare that many patients do go through. You go to your doctor, you have a bump, either on your stomach or on your feet or on your toes, and he just dismisses it, or maybe you're having some pains, he thinks it's just fever, cold, gave you pain medication and sent you home. If it is cancer, such a mistake on the part of your doctor can be life-threatening. That is, your cancer is misdiagnosed. A physician's conduct in such a case, your doctor's conduct is beneath the level of care for that professional who fails to order timely screening, use outdated tools and procedures, or simply fail to diagnose cancer. I want you to remember this again. Let me repeat it. Your physician's conduct, if they misdiagnosed a disease like cancer, is considered beneath the level of care for that professionals who fails to order timely screenings or use outdated tools and procedures, or simply fail to diagnose cancer. These mistakes deprive patients of life-saving treatment options. This is serious, folks. Can you imagine you have cancer? Take, for example, a woman with breast cancer, which early intervention could have quickly resolved, or men with prostate cancer, which early intervention could have easily saved their lives, and your doctor took it for something else. That's misdiagnosis. And because these mistakes, you are deprived of life-saving treatment options, because the early screening and detection of this illness, this serious condition like cancer, allows you to have some life-saving treatment options, which could either eliminate disease or, put it in remission. A cancer misdiagnosis lawsuit can help offset medical, lost income, and psychological treatment cost. What that means is this: if you are misdiagnosed for cancer, you have an option. You can file a lawsuit that will help compensate you for your medical bills, which can be astronomical, especially if that cancer is at stage 3, stage 4, or just at an advanced stage, which early detection could have prevented you going through, being exposed to such huge medical costs. So that will include lost income. That is any amount of money that you have lost at your job trying to treat for cancer. Traveling, in some cases, some will have to travel to some of the big cancer centers in some of the major cities. All those costs, all your medical costs, all your lost income, and any psychological treatment cost that you go through can be recovered in a medical malpractice lawsuit that was based on misdiagnosis. Now let's talk about missed. And when I say missed, M-I-S-S-E-D, diagnosis that describes the lack of a diagnosis, usually leading to no or inaccurate treatment. An example will be when a woman is told the small lump in her breast is benign, only to learn later it is in fact malignant. That is serious. Now, this happens more often than you might think, especially for women of a lower social economic color women, minorities. If you are faced with a situation where your doctor missed diagnosis or simply was inaccurate in the treatment, leading to inaccurate treatment, that is, if he says, the lump in your breast is benign, there's nothing in it, that will be a misdiagnosis. Conversely, a patient may be showing symptoms of an illness or medical condition and sees their doctor for an analysis. If the patient's concern were too quickly dismissed, or the doctor only did a cursory exam before declaring everything is okay, that is a missed diagnosis. Some of the doctors attends to like 80 patients in a day, and they are just in your face or in your sight for 5 minutes or 4 minutes. What is wrong with you? Oh, no, it's nothing serious. Take this medication, and that's it. It might be a serious condition. that if that doctor had done proper screening, that would have really resolved your medical condition. That is missed medical diagnosis. If the patient's concern were too quickly dismissed and the doctor only did a cursory exam before declaring everything is okay, that is a missed diagnosis. That can lead to worsened medical conditions and a poorer prognosis through the lost opportunity for earlier care. That is very important, people. A lot of these medical conditions that kills people is simply because they were not diagnosed in time. That is misdiagnosis. If those medical conditions had been diagnosed properly, accurately, and timely, lives will have been saved. Long, prolonged, unnecessary treatment will have been avoided. So, whenever you are considering a medical malpractice lawsuit, and this is a tip that I'm giving to you, your first step, the first thing when you suspect there is medical malpractice with the conduct of your doctor, the first step is to obtain your complete medical records. You don't have to tell him what you want to do with it. Just say, look, I need my complete medical record. Many will suspect that's probably what you want to do with it. Especially from the doctor you are alleging committed the malpractice. A case is stronger if you discover the malpractice from a subsequent or remedial treatment by another doctor. I get these calls pretty much often in my office where clients call me and say, look, one surgery was performed by one doctor. It didn't go right. They were in severe pain and worse condition than before the surgery. And they had to go to another doctor who performed a remedial surgery, who performed a surgery to relieve or to resolve the pain that came from the previous surgery performed by another doctor. When that happens to you, that is a false sign that malpractice has been committed. Ask for the complete medical records from your doctor, the first doctor that performed the surgery, and also ask for the complete medical records from the subsequent surgery that was performed to remedy or to resolve the pains of the first surgery. Remember this, doctors, not lawyers, decide if medical malpractice exists. What we do is we take those records as lawyers, we send it to another doctor. Preferably, we like to use doctors that are not in the same locality to review it and let us know if medical malpractice has occurred. When they do that, if a lawsuit is about to be filed, we have to accompany a certificate issued by the reviewing doctor to certify that an independent professional has reviewed those medical records and found that the level of care, the profession is beneath the standard of profession for that particular doctor in that locality. So if you have any question, call us. Our phone number in Mississippi is 662-342-7007. and you will see our phone number in Memphis below. Or you can email me on salu@salulawfarm.com. And remember this, consultation for medical malpractice claim is free. Now, don't call my office and say that I tell you that everything is free. No, only injury cases we give free consultation. You don't have to pay anything to talk to us. Thank you. Feel free to subscribe and share, and let us know if you need any if you have any additional question, or if you want us to discuss another topic. Thank you for watching.